So good morning. There we go. Now we're awake. Now we are awake. Well, I'm Council Chair Derek Leon Davis, and I am blessed with the activity of my limbs and the faculty of my mind by our good Lord and Savior, Jesus Christ, to be here today on what is probably one of the most important things that we could be talking about in Prince George's County. I've been asked to make sure that I identify a few people here today that are your partners in making sure that the heart and mind of Prince George's County coalesces around the opportunities of Prince George's County. I call them colleagues in elected officialdom, and what I'd like to do is just make sure I recognize them. And I'll start off first because they're on the first page in no specific order, and recognize my great compadre on the county council who has also served for many years as our representative on the Dimensions Healthcare Board, and my very good friend and neighbor in service, Miss Andrea Harrison. Give her a round of applause, please. I know we have also in the room today a former delegate, Miss Melanie Griffith. I don't see Melanie, but if you give her a round of applause. I also know we have with us today Mr. Ryan Middleton, who is representing Senator Ben Cardin, our United States Senator Ben Cardin. Give Ryan a round of applause. And I see my very good friend, the person who represented Council District 6, and he's a former council member. I know him as whatever you say, sir, Mr. Sam Dean. Where is he at? You know, no one of us is more important than the all of us. No one of us is more important than the all of us. The climate in America right now is decidedly different. We don't know exactly what we have. We know we have something and we have responsibility. And I only bring that to bear because for several years we fought to bring to bear the Affordable Care Act, many people know affectionately as Obamacare. And what we know right now is that there is a change of brew. We don't know what that change will bring. We do know some of the things that it brings will create trouble, not only for everyday citizens, but how we operate in the healthcare space. Medicaid grants, something that you need to think about putting your head. The federal government provides resources that come down that help us facilitate your health care. Comes from the federal government. Coverage for individuals. How many of you, you don't have to raise your hand, how many of you are covered by health care? You don't have to raise your hand. How many of you know someone who isn't covered by health care, who needs? You don't have to raise your hand. These are the because you be raising your hand all day. But the reality is we rarely think about this beyond the meeting or beyond the reality when someone attempts to attack what is at the very fabric of our being. So I want to make sure you understand as I tell you about the folks in the room, and usually I'm the upbeat character. You know, when I show up, the council chair, I try to keep everybody pumped and I try to keep us moving in the right direction. But the reality today is we're in a very seriously uncharted time, both at the state level and at the federal level. My colleagues and I and several of our colleagues across the state rallied the other day over in Annapolis for the exact same reality that brings you here today, to ensure that we protect our heart. We look at this regional medical center like it is the heart of Prince George's County, and that what we've been doing over the last several decades is preparing this new heart for Prince Georgians to come and be able to take care of their health care needs at a new place that would generate the type of fervor that Prince Georgians and Southern Marylanders deserve. We can't afford to let anyone attack that, which is why I say to you that those that you elect need your voice and your spirit prepared for whatever it is to protect the heart of Prince George's County. Can I rely on you guys for that? Okay. I'm going to need a little more enthusiastic yes, but we just getting started. It's an exciting opportunity. When you came today, and I need you to think about it from this perspective. How many of you have been to Prince George's Community College in the last 4 or 5 years, more than one time? You've watched this community college grow, haven't you? Isn't it a gem? You need to give Dr. Charlene Dukes a big round of applause. She has turned this community college into essentially the place that the last president visited probably more frequently than any community college in the country. And now that he's gone, he has left it incumbent upon us to continue to grow in that fashion here. That's the same thing that we're doing with the healthcare industry. Oftentimes we celebrate in Prince George's County, I'm just making sure you get the whole flavor. We often celebrate that in Prince George's County, we have some of the most pristine and beautiful parks that have ever, matter of fact, we get gold medals for that. I don't think you understand the relationship yet, but we're here today because the Maryland National Capital Park and Planning Commission has been working as a strident partner with Prince George's County's Health Department, with Prince George's County government, with Dimensions, with the University of Maryland Medical System to do the strategic plan that is, it's not about what happens after you get hurt, but it's how you do preventative medicine, as I'm often admonished by my healthcare consultant, Dr. Wright. It's not about what you do after the fact, it's about what you do getting up to the fact, right? So let me acknowledge a very good friend and partner, Miss Elizabeth Betty Hewlett, who is the chair of the Maryland National Capital Park and Planning Board. Give Betty a round of applause. And I'm also told my colleague from District 4, Todd Turner, is here. District 4 Councilman Todd Turner, were you in here? Okay, Todd's in here somewhere. I know everyone was at a breakfast this morning. But let me say this, and I'm going to go to my seat. Not many people know that the county council has one duty that makes it important for us to be intricately involved in the responsibility of health care. We sit as your Board of Health. So the 9 members who sit as your land use authority, who determine how things are built, where they go, what we do with regard to zoning, the folks who, when the county executive is finished playing with the numbers and sends down a budget, we get to say, yeah, no, that's another one of our duties. But our responsibility as a Board of Health, especially over the last decade, I will say, has been one that we have taken immensely seriously. Bringing this regional medical center to you, to Southern Marylanders, to Prince Georgians, so you can bring your health care back to Prince George's is critically important. Now, you don't have to raise your hands for this one right here either, but I want you to think about it. How many of you leave Prince George's County to go get your health care services? You don't have to raise your hand. Don't tell nobody. We're not church. As the pastor say, don't look down the aisle, because that person probably you. But what I want you to think about is how powerful it would be if you brought it back to Prince George's County. How powerful it will be when we are able all to proudly welcome folks from Southern Maryland, Washington, D.C., and other places who want to come use our health care services. How proudly you will feel when, in fact, as opposed to taking your resources and expending them somewhere else, where your dollars go to benefit another community, you're benefiting yourself, and you're taking care of yourself. I want you to think about that. I want you to begin to take that very seriously. I don't think we've taken it seriously enough. When I first was elected, I used to make the comparison to how we shop or where we eat, right? How we shop or where we eat. How we shop and where we eat, is that more important than health care? I don't think so. So we need this room of 400 or 500 people to do something that back in the 90s, if the great Wayne K. Curry was here, he would say, tell Lottie, Dottie, and everybody. That's what he would say. If I was at the First Baptist Church of Glen Arden, the pastor would say, Snapchat that, Facebook that. That's what he would say. You know what I say? Run tell that. You tell everybody across this state and across this county, across this country, that Prince George's County is taking care of its own heart. And we value health in this jurisdiction. Thank you very much, and I'm going to get up out the way.
So good morning, everybody. Can we say a good morning again? Everybody got up this morning early and came over here to the community college. Let's say good morning. Good morning. I thank you so much, everyone, for being here. My name is Betty Hager-Francis, and I serve as the Deputy County Administrator for Health, Human Services, and Education. And I am just so grateful to you for being here this morning and for continuing to be our great partners as we build our healthcare system in Prince George's County. It is our pleasure, all of us, it's our pleasure to be here today to update you on the status of the Regional Medical Center and how far we've come with the Primary Healthcare Strategic Plan, which many of you helped us develop. First of all, I'd like to once again thank Elizabeth Hewlett, the chair of the Maryland National Capital Park and Planning Commission, and Vanessa Akins of the Planning Department of the Commission for their partnership as we develop the strategic plan. Without their help, I don't know where we would be with the plan, and we certainly would not be having this event today. So we really appreciate the expertise and the effort that's gone into making today's event what it is. I also want to thank all the staff that came today. I want to appreciate that our Director of Social Services, Gloria Brown Burnett, came right off a plane to join us this morning. I hope you don't mind. There's certain people who have just been working so hard to in this partnership. You just have to recognize them. And all that staff out there, county employees, have come this morning to make sure that this event goes well. So I just want to thank all of them. They can't hear me, but that's okay. As you know, County Executive Rashawn Baker has made health care one of our administration's top priorities and committed to the improvement of the county's healthcare delivery system in order to improve health outcomes of our county residents. And you're going to hear some really great news today from our county health officer. We are moving boldly forward in our mission to improve the health and quality of life for our county residents. Hey, Craig. Today you will receive an update, as I said, from Pamela Creekmer, who is our health officer, on the health status of Prince George's County, and her presentation will show you some improvements that have occurred in the health status of our residents and some areas where we still need to do a little bit more work. I'm going to provide you with an update on the Primary Healthcare Strategic Plan, which many of you worked on. It was published in December of 2015, and some progress already has been made. This collaboration between healthcare professionals, community leaders, strategic partners, and other residents is really helping us to revolutionize the health status of our residents. Today, you're also, and I know this is really what you came for, going to get an update on the status of the Regional Medical Center, and it's very, very good news. We've made really significant progress to address our health disparities, but this Regional Medical Center is going to change the game for healthcare in Prince George's County. We are moving forward with respect to actual construction of the new hospital here in Largo. Most of you know that on October 20th, 2016, we actually got approval after 3 years of working on it. We got approval of the certificate of need. Many people worked on it. It was a perfect submission finally, and we are just so thrilled to have gotten that approval. And some of the people who are responsible for it are sitting right here today. Daryl Mealy is going to make part of the presentation this afternoon, and Craig Motzkowitz, did I say it right? And Jeff Johnson. Is Jeff Johnson here? Well, okay, but, okay. Anyway, we can expect to have a groundbreaking for the Regional Medical Center sometime in the summer or early fall. Listen to what I said. We're actually going to have a groundbreaking in the summer or early fall of this year. Isn't that wonderful news? Yeah. Once again, we thank you so much for being here today. We look forward to spending the next couple of hours with you on our favorite subject, healthcare. Now, I was going to introduce Neil Moore, who is the CEO and president of Dimension Healthcare System and a wonderful partner to us, and the gentleman who I must say started at Dimension's Healthcare System as the CFO, the Chief Financial Officer, became the CEO and really did bring the system to the point that the University of Maryland Medical System is able to affiliate with Dimension. So I want to give Neil a hand. And now it is my great honor and pleasure to introduce my boss and our county executive and the one who's been leading this charge toward healthcare improvements in Prince George's County, Rashern L. Baker III.
How's everyone doing this morning? Good to see you. This is going to be a great update. I thought about something as I was actually walking in and sitting over there waiting for them to call me up. This has been a long journey for us, and it hasn't been an easy journey, and it's unfortunate. And I don't just mean that by the time that I've been county executive. This has been a long journey for the county, almost 30 years. If you think about it, when I first came into office, not the county executive office, when I became a delegate, we were talking about, Neil, how do we make sure that Prince George's County Hospital survives and is viable? That really was the discussion. It wasn't how you expand quality health care throughout the county in the southern part of the state. So it's been a long journey. And there are those who fought hard and stayed with it. And as I was sitting over there, I saw the councilwoman who really put a lot of time and effort, cried and struggled, pushed through, made hard decisions, to get us to where we are. And I'd like for her to stand up. Councilwoman Harrison, can you please stand up? Because at the end of the day, we're going to build a regional medical center for Prince George's County in the southern part of this state. It is going to happen. We are going to have downtown Largo. And when all of that happens, there's going to be a lot of people who are going to stand up and say, great, and they're going to cut a ribbon. But I want you to remember the people, and you're in this room, who fought hard to make it happen. Because we couldn't do it without the Affordable Care Act. Say what you will on Capitol Hill, The Affordable Care Act allowed us to get to where we are today. That is an important aspect that must be kept, and we must fight for it. Because if we didn't have more people with insurance, we couldn't do that, right, Neil? We couldn't get to where we are if we had not fought hard in the legislature to put a guaranteed money in the budget. So we wouldn't be doing what we're going to ask you to do today, and that is to call the governor and tell him to live up to the law. Not to a promise, but to the law. The county is putting in its money. We need the state to put their money in. Those things are important. Because without it, we can't provide the health care that is needed. So it's not about the people on this panel, it's not about me. It is about the folks who need quality health care, who need access to it, and should have a facility that is as good as the people are. You know, they have done a great job at Dimensions and the hospital with little resources, or minimum resources. They brought it back. But in order for us to move forward, we need the resources to do that, but we also need the help of you in the community. So I look forward to the panel. You got a great panel. Thank you for being here. It's going to be a great facility, but the fight continues. God bless you. Yes, Councilwoman said, explain what you meant by the law. This is what happened, and this is why we need you to call the governor. When the new administration came in, and by the new administration, I mean the Hogan administration at the state level, there was an MOU between the state, the county, Dimensions, and University of Maryland Medical System, where we would share in not only the building of the new hospital, a third, but we would also commit the state and the county to the ongoing funding of the operations of Dimensions in the hospital. $30 million. Well, the new administration, the Hogan administration, decided that was an MOU between Governor O'Malley, the county, and these other entities. That's what they told me. I said, well, you know, I served a little bit in Annapolis. I was there I stayed awake sometime. What I remember is that when the governor signs, he signs on behalf of the state. The state. When we sign on behalf of the county. Not Rashawn Baker, not Derek Leon Davis. And so since we had a disagreement, what you do is you go either to court or you go to the legislative body and you get legislation. We went through the legislative body and put in law that said the state would pay its share, in law, what they would pay. So we wouldn't have to go back and forth with this fight throughout, and we wouldn't have nervous partners. So we thought it was settled law because you know why? They passed it. The governor didn't veto it, so therefore he must have been in favor of it. He was the governor. You know, he could have vetoed it if he didn't like it. And they reaffirmed it when they came in. So we're thinking this year, all we're going to talk about is how soon we're going to do a groundbreaking, what it's going to look like, you know, what facilities we're going to have there. And since we're all partners, the state, Dimensions, University of Maryland Medical Center, and the county system, that we're all partners. Because we all want the best from Maryland residents. That if one of the partners changes their mind, they might call you. Say, hey, you know, something happened. Let me just, can we talk? No call from the governor. We met with our delegation in Annapolis and said, you know what, for the first time in our administration, since all of us came in, since I came in as county executive, hospital funding was not the #1 issue for the county. because it was already settled law. And we said we just need to make sure that we talk about what type of quality care we're going to have there. So we walked away from the first day of session thinking this is really going to be about transportation and education. And then the governor's budget comes out, and the money is not only there, he strips it. He decided unilaterally that we really didn't need, $30 million, that maybe we could take a lesser amount, and that he wasn't going to put the money in the capital budget because he figured, you know what, you ain't going to need that for a while. No discussion with us, not respecting the law, unilaterally made, and we find out when a reporter sticks a mic in my face and said, well, how are you going to continue operating a hospital with less money? And I said, what the hell are you talking about? That's exactly what I said. I forgot I was on camera. He said, well, but I did mean it. Good thing I didn't know it. I said something else. So the bottom line is this. We had to go to Annapolis and actually have the governor stand up and say, why did you do this? And be questioned by the legislative body about, well, why do you need the money? That's irrelevant now. The law was passed. We had that debate 4 years ago, 2 years ago, 3 years ago, last year. The law was passed, the debate was made. It is our money. We are taxpayers. You have responsibilities. And so right now we're saying to the legislative body that we demand that you make the governor live up to his promise. Now, he told me that he made a deal with or dimensions. Lenil, did he tell you did you tell him you didn't need the money? Because if you got extra dollars, you need to tell us. I'll end with this. I don't say that tongue in cheek, because that is exactly what he said to the media when they went to him. The governor said, well, I talked to and dimensions, and they don't need the money. It was alternative facts. Because we're living in a new world, you can just say anything.
Nothing means anything.
You know what? If it wasn't so serious, it really would be funny.
Yeah, that's right. Exactly.
I said this to them, and I'll say it to you. I had to spend, because my wife was not feeling well, a month at Laurel Hospital. So I was up there every day. And she got the best care you could ever ask for. But what you find out when you spend a lot of time in these facilities, and I'm the county executive, so there are a lot of resources and help. But you see what we don't have. And it couldn't help but think about, gosh, I could call our health officer and ask questions. But what if I wasn't the county executive? What if I didn't have the type of insurance I had? And I'm scared and I'm sitting in there and there aren't the resources. When it becomes personal to you, it should make you change your behavior and think about not just yourself, but how it affects people who don't have the resources you have. And so when I get mad, it's because of that. I know what it's like. And I can only imagine what it would be like if I didn't have the resources to ask the questions, or we didn't have a facility where, if my wife just went in as Krista Beverly, that's why when somebody says, well, you don't need it. Okay, let's let you go right there. You go there. When there's one nurse to do the rounds for 20 patients, and you're the last person there, and you walk in, and the nurse hasn't visited your loved one, see how you feel. When you go home and there's nobody at home to make sure there's not a nurse there, a social worker to help you prepare your house for your loved one to come home, see how you feel. See if you need the money. If there's no hospital right over there that can take you brand new with all the resources available, see how you feel. When there's not police officers and state troopers that can drive you with the sirens on to a hospital, but you're depending on just the way everybody else goes. That's why this is important. That's why it can't wait 2 years, 4 years. It should have been built already. We should demand the money in there to make sure the quality of health care goes on. That's why, and I've gone on too long, but that's why we need it. God bless you.
Good morning. It is indeed my honor and pleasure to be with you this morning, Saturday morning, waking up a little bit earlier than I normally would, but I'm glad to be here. I would like to acknowledge a couple of individuals before I present my remarks. Dr. Joe Wright is here, and Dr. Joe Wright has like 3 different responsibilities. I think it's important that I'm aware of, and there are probably others that I'd like to share with you. Dr. Wright is the chairman of pediatrics at Howard University. He's the chief consultant to the county council and the board of health, and he's also a Dimensions Healthcare System board member. Thank you, Dr. Wright, for being here this morning. Councilman Todd Turner was acknowledged, but he was not in the room at that time, so I'd like to acknowledge him. He's here. And I'd also like to acknowledge the Dimensions Healthcare System board members, some of whom are elected officials, but I'd like them to stand so they can be acknowledged. The board members of Dimensions Healthcare System. Pam Crickmore, Dr. Wright, representing Dimensions this morning as well. I'd like, on behalf of the full board of directors at Dimensions Healthcare System, the employees, the volunteers, I'd like to thank you for your interest in the Regional Medical Center. It has been, as you heard, long in the making. And I'll put a pin right there and acknowledge the folks who are here from the University of Maryland School of Public Health that actually did the study and recommended that a new regional medical center need to be built to replace Prince George's Hospital. Dr. DeShanka and your colleagues, please stand. Yeah. We all know that the new regional medical center is only one component of a comprehensive approach to transforming the county's healthcare system into a clinically, technologically advanced healthcare system that will provide residents with exceptional medical care. We want it to be the best healthcare system within the country. And that healthcare system will be supported by the clinical academic medicine organization, as we all come to know, as University of Maryland Medical System and the University of Maryland. Our efforts in transforming the healthcare delivery system include significant efforts in improving access to primary care, expanding outpatient programs throughout the service area, and developing more comprehensive, coordinated community approaches to wellness, with the objective to improve the overall health of all the residents within Prince George's County. Our health vision, which includes our wellness goals, are now progressing through the commitment of, you heard from the county exec and you heard from the chair of the county council through Prince George's County government, the state of Maryland, the University of Maryland Medical System, and the University of Maryland, the governing board of the Dimensions Healthcare System. Collectively, we have been working tirelessly. And as you heard, working on the new regional medical center dates back many years ago, but our efforts really got propelled in the last 5 years after the study came out that says we need to replace Prince George's Hospital with a state-of-the-art facility. This could not have all been done without good leadership. So I'd like to take this opportunity to thank our county executive and the county council for all their support that they have given to the healthcare system to get us where we are today. Let's give them a round of applause. A few other names I think are very important to acknowledge. Tom Himmler, who works for the county exec, Ms. Hager Francis, and Mr. Inucci. Those are the individuals that we work very closely with from the hospital in getting us to where we are, and I'd like to acknowledge them as well. Our health officer, we couldn't do it without that partnership as well. Pam Creekmore, whom was introduced, and also will provide some remarks to you all, as well as the Maryland National Capital Park and Planning for their efforts. And they were acknowledged also, but I felt it's important to re-acknowledge them. I also would be remiss if I did not recognize our strategic partner, the University of Maryland Medical System. Bob Krensick, John Ashworth, Steve Bartlett. Dr. Bartlett is the champion, and he's the chief physician and champion in all the clinical programs that you'll hear about later that we're working on, as well as the Dean of the School of Medicine, Dr. Al Reese. We have come a very, very long way, as I said, and all it took, it's a village of individuals to get us where we are. Now I'd like to, before I close, provide you with a quote from Abraham Lincoln that says, "Commitment is what transforms a promise into a reality. Commitment is the stuff character is made of, the power to change the face of things. It is the daily triumph of integrity over skepticism." As you all are aware, this has been, as I said before, long in the making. You will hear this morning of the progress that we have made, how closer we are to bringing what was once a dream to reality. I hope you not only enjoy this morning's presentation, but also be proud that you have been a part of this process in developing the new regional medical center, and also to improve the expansion of primary care services across our county and Southern Maryland region. I'll do my last acknowledgement. Darrell Mealy, who has been working on the chief project individual from the University of Maryland who has been working on this project. Darrell, thank you for your tireless efforts. Mr. Moskowitz, thank you for your contribution. And of course, I have the Chief Medical Officer from Dimensions Healthcare System this morning with us, Dr. Carnell Cooper, whom you will hear from later. Again, my heartful thanks to each of you for your support that you have given to us in the quest of delivering better health care within Prince George's County and the Southern Maryland region. Thank you very much.
Again, give our panel who brought us welcomes, our leadership, especially our county executive, my boss, Elizabeth Hewlett. Give everyone a round of applause, please. Senator Benson, welcome, and if you could come on in and have a seat, give her a round of applause. Thank you so much for your leadership. We are now going to move into our next segment. And we're going to bring forth to you an individual who continues to ensure that we as residents of the county do what is necessary to improve our overall health. This means eating better, exercising, so why don't all of you stand up and just stretch because you've been sitting, because she believes in exercising. If you can get up, stand up. And just shake it off because you've been sitting. And I know she will be happy that I've told all of you to shake it off, because she always encouraged me to eat better, stretch them limbs. And she is hoping that you're doing what is important before you get sick to visit your physicians. And hopefully you visit them right here in Prince George's County to improve your overall health and health indicators. So again, stretch it out as we bring you part 1 of our program, and we're going to say, let it roll. Thank you. Oh, you got a commercial. We have a commercial.
So this is an unprompted video commercial. And as we were sitting there, my partners and I, and listening to what we essentially believe is the crux of the matter, and we started off with the comments with regard to the climate in the country, the climate in the state. We think it's important, especially in this room, that everything you hear today you take very seriously, and you write this phone number down, 1-800 Prince Georgians, 811-8336. That's 1-800-811-8336. That's the number on the website for the governor. You let him know, don't play funny with Prince George's money. Our health care isn't a game. It's not a shell game. You let him know that. We already have. This has been brought to you by the sponsors of this event. So thank you very much. Make sure you do that.
Thank you. And it's just the bottom one. Okay. Good morning. Oh, I'm so thrilled to be here. And I see so many regular, familiar faces. I think this is the 3rd or 4th time we've been together at a different venue to have this update. And I am so empowered and so encouraged by you. And you keep us all honest. So thank you for being out this morning. I've got a commercial of my own before I jump into the presentation. Let me see if this is working. Maybe. Gotta be, there we go. Okay. Just as the county executive spoke to you about the real deal, I love how Councilman Davis talked about getting funny with our money. You know how we all are about our money. You know, we are really specific about our own money. This is our money. It is taxpayers' dollars. As a health officer, I can say a few things. I'm not an elected official. What I need you to understand is you deserve access to excellent facilities, excellent physicians, every kind of specialist that exists today in this county. You deserve it. We've got 5 hospitals in Prince George's County. I need you to know there is no favoritism as the health officer. I'm not an elected official. As a matter of fact, I'm on 3 boards. I would not mind being on all 5 boards of the hospital because I am here for you. That's my job. My job is about the health of this public, the people of Prince George's County. You deserved a replacement hospital many years ago. And if I spend too much time on this topic, I'll get as angry as the county executive. Because I'm a resident of Prince George's County for 23 years. 33 years married, 34 years healthcare experience. Most of that has been in this county, working in different places, sharing my gifts around, okay? I need you to know that when I walked our existing facilities, it took every inch and ounce of my being not to scream. I didn't know what I didn't know until I knew. So I'm an activist, I'm an advocate for you. This is not about Mr. Baker, not about me, not about anyone else but you. I've walked in many of hospitals throughout this state, Virginia, you name it. I'm telling you, you deserve a replacement hospital. We've got 5 hospitals in this county. We need all of them. But all 5 together don't meet the needs of the residents of Prince George's County today. So I like to keep it real and keep it honest. And I'm going to use that phone number now that I understand the specifics, as you need to use this phone number. And then you need to tell 20 other people to dial that phone number. Because if it's all politics, because this ain't politics. This is not politics. This should not be politics. We're a county of 1 million people. It should not be politics. So the one thing you can say about me, I'm disgustingly passionate about healthcare, have been, always will be, but I keep it straight, and I don't stutter. I'm expecting you to call. I'm not expecting you to get 10 or 20 other people to call, because this is about politics and lives, okay? I'll stop there. The nice PM Krigmer's coming back. So, good morning again. I'm thrilled to be here, as I said that. I'm a mama, married 33 years, and I'm a nurse. You know I know how to tell you the truth in a nice way. And when I have to raise that voice a little bit, I'll do that too. And you guys moved, so it's good. So the job of a health officer and my entire agency is to protect public's health, to assure the availability of access to quality healthcare services, and to promote individual, that means you, and community responsibility for prevention of disease, injury, and disability. That's the whole mission of the Prince George's County Health Department. We are absolutely moving in the right directions, and I think it's because all of the healthcare stakeholders in our county are swimming together in this river. We can agree to disagree about those things. We all need to make money. We all need to make business initiatives. But I have to tell you, I'm so proud of my county because we're all on the same page working together. And we're working for your benefit. Okay, let's see if I can be smarter than this. My daughter would be laughing. Okay, I went in the wrong direction. She would be cracking up. Okay, here we go. So, significant health indicators. So you know the first time we all came together about this, you guys saw a slide similar to this. It's a little bit more expanded, but we try to keep the baseline around the same so that we're measuring the same things over year to year. And what you can see by this slide, Prince George's County now surpasses the state with the life expectancy compared to where the state is. So that's not always been the case for Prince George's County. This data, okay, that's a hand clap right there. Now, we're not going to break it down by ethnicity or any of that because the numbers do get a little different that way, but overall, where our baseline was 77.8, we're at 80%. Now, when you look at the district, you look at Northern Virginia, you look at Montgomery County, those numbers are different. But primarily, we're going in the right direction. When you look at the rates of cancer, there is a 17-point decrease in the rates of death. Now, all of this is around deaths, okay? So it doesn't mean that the numbers of folks living with cancer, fighting cancer, but this is deaths associated to cancer. There's a decrease in those 17-point drop in that figure. We have an epidemiologist at the health department, Donna Perkins, of those of you who are doing grants and nonprofits. She is a beast on these numbers, and we go toe-to-toe all the time, because if it's not right, she won't give it to me. And that's a good thing. But what I will say about this is there are so many more pieces to this puzzle data. We have created a website that is free for you. Write this down so that when you want to go back and do some checking or you need to do some other things, it is www.pgchealthzone.org. Free data site, you can get to it, you can look for poverty rates, you can look at a variety of things. We're continuing to make it improvements on this so you can find the information you're looking for. But we love this site, and you can use it. We created it for you. When you look at death rates from heart disease, and we all know that, we have a large burden for the chronic diseases in our county when you look at the demographics of our county, but that's also decreasing. by 51.6 points. Deaths by diabetes, that's a 3.1 point drop since our baseline year. Now, the area in red, and we use simple things, red, green, and yellow, but the red means that we're going up and we still have work to do. So these are emergency department visits for hypertension per 100,000 population. And so there are many reasons for this. I won't speculate. This is only for Maryland hospitals, as you know. Many of these, our residents, we go to hospitals in the district. Some people even go to hospitals in Virginia, depending on connection and where your provider is. But this is just for the hospitals in Maryland, so we still have work to do. When you look at the death rates for kidney disease, that's also down by 2 points. While the life expectancy is increasing across populations, racial disparities still exist across the county, and I will say that you do see differences when you break it out further. Now, the improvements for the death rate's one thing, but the incidence of chronic disease and the exacerbation of chronic disease, that's where the individual responsibility and the community responsibility comes in. So there are many of us who are living with chronic diseases, hypertension, high cholesterol, diabetes, you name it all. How we fare and the quality of our life absolutely depends on how well we're taking care of ourselves. And it doesn't have to be expensive, and it is our responsibility to try to eat right, and that doesn't mean go vegan, okay? Because you see, I'm not down to my pre-marriage weight. At 56, I don't think it's ever going to happen, but we are still working on it. But moving is so important, and I always like to tell you, my dad is 93. Each year I'll talk about this guy. He is in excellent health. He is going to outlive all of us. He says it's not going to happen, but we don't believe him. And it's only because he ate home-cooked food and he moved. He's never been to a gym. He's never seen a piece of equipment. He had a landscaping business. He was a security guard at a hospital. He dances like a fiend to date at 93. And he's single. I'm just saying, to the death. So I like to keep it real. The nurse in me wants to make it easy for you to figure out how to do it. So it's small little changes, but you got to eat healthy as you can. Whether you're shopping at Aldi or you're going to Wegmans or Whole Foods, you can find what you need in any price point. But the other thing is you got to move. And if it's dancing, square dancing, swimming, whatever, walking, whatever it is. So I had to do that commercial about managing our chronic diseases. I'm in with you. I am not talking at you. I'm talking with us, okay? And you can't run away from your DNA. So here, no pity party. Get over the pity party time. I got diabetes. Okay, all right. Most of us couldn't run from our DNA. 4 generations of diabetes. There was no way I was going to run from it. Well, maybe if I looked like Dr. Kleiman. She is just such a string bean and gorgeous. If I got to her, I might spare, nah. But you can't run away from your DNA. So I'm just saying, we work with what we have, but it's our responsibility to do the best with what we have, okay? So the next slide. So you see these equal marks here. And so let's start at the top. So the top one talks about the percentage of adults at healthy weight. So I got to tell you, this is a hard one to move. This is over years we're going to do it. The flip side of that means that there are 60-some-odd% people who are together overweight and obese. But the real deal is where we want to see is that increase in people who are at a healthy weight increase, but it will take some time. And I know I've said it at conferences before where we talk about that documentary a few years ago about the weight of the nation. There are so many forces working against us to get this under control, but we need to be aware and we need to work it out. So what is it? Eating as healthy as we can and moving. But this is a figure that we're going in the right direction, but it's going to take a lot of work. And this is what we really want to focus on. So when you look at the percentage of youth, high school, who are obese, it's basically statistically insignificant. It's about the same, 15%. So new on cases of HIV, and this is an issue for me. So it's statistically incorrect, but statistically insignificant. But what I have to tell you, and you'll hear me say it all along, it is 100% preventable for new cases of HIV, okay? Because you can't get it in the air, you can't get it by kissing and touching, okay? 100% preventable. So it is really protected sex, okay? Now, a lot of other things in there, a lot of stuff we'll talk about down the road about PrEP and some other things, because the hardest thing to do is change behavior, particularly when it comes about sex. Come on. Biblical. Nothing new on the sun. But we don't have to have as many new cases. The piece of this is we're testing more. And so what I need you to know is there are a large population who don't know their status. We're testing more. Our hospitals are excellent partners. We have worked hard with legislators, our coalition, to change some of the language to make it easier to what we like to say, routinized testing. And so when you come into an emergency room, you're doing my CBC, you're checking me for this, that, and the other, an HIV test should be in that panel that you do. And it's easier for hospitals and providers to do that today because of a change in the law of 2015. What we found was that most residents thought that they were getting that test and they were fine. So the real deal is, if your provider is not asking you for it and you're assuming that it's done, don't assume that, because it's going to take us a while to educate and make people understand it's a lot easier. Ask for the test. 33 years of marriage, I have to tell you, no one had asked me for a test, to do the test. Since my daughter, I had the test since then, but my daughter's 25, so I'm going to say this was about 5 years ago, so she was 20. No one had asked me for an HIV test, to take an HIV test in 20 years. They looked at me. She doesn't look like somebody who would have HIV. What does that look like? I like to tell you, if you're having sex and it is a wonderfully good thing, you need to be tested to be sure, okay? So, needless to say, I've been tested, and I think everyone should be tested. And if you know your behaviors are not as safe and risk-free, do it more frequently, okay? Because, why? It's a chronic disease, okay? Chronic disease, we talk about stigma and all this stuff. Our health department is a little progressive on how we think about this. HIV is a chronic disease, all right? Chronic disease. Get tested, okay? So now, there we go. So I'm going to shift to the Affordable Care Act, and our county executive, Councilman Davis, everyone has done a great job to talk about the importance of the Affordable Care Act. And the truth of the matter is, I'm going to just depoliticize this, the importance of access to health insurance for all Americans. Okay, does that take some of the politics away from it? Okay, because the truth of the matter is, I got a public library I can go to, I got public schools I can send my kids to. You're not making it a vehicle for me to get my health care. And if you take it as simply for primary care reasons, I can't get assistance to go see the doctor to maintain my chronic diseases. So I want to take the politics out of it. People need help. We need to have affordable health care. Call it any name you want. I really wouldn't care what you call it. Just people need insurance. Okay? And so when you look at this slide, in Maryland, and Maryland was ahead of the game, we expanded medical assistance, or Medicaid as it's known, so that more people, more working class people, could qualify to get help and assistance for insurance. So today we've got, and this is as of December 16, 150,000 county residents are enrolled in a medical assistant kind of a product, whether it's Medicaid, MCHIP program, one of those. And then 24,000 county residents are enrolled in our qualified health plans that they purchase on the health exchange. That's about 20% of our residents. Okay, wow, because of the Affordable Care Act. Now, Medicaid or medical assistance is ongoing, so that expansion in Maryland is still here. And so you can continue to enroll your children, your family and friends and neighbors. They can continue to enroll, and we want that to happen. They have until Tuesday to enroll in the qualified health plan and on the exchange. Okay, so I'll tell you how a woman at HRSA told us back in December. And thanks to the amazing team at DSS who are doing our Prince George's Health Connect. Today, there's a lot of talk in the air. We really don't know what's really going to happen. But what we know for sure is there is a law on the books, and that's what people are operating with today. So that's what we're operating with today. So by Tuesday, if there are people who are still not insured, you need to be encouraging them to go online and get that done. The other thing I want you to remember, if you think it's someone who's going to be eligible for medical assistance, that is all year round and ongoing. Okay? Great. Make sure I didn't forget to tell you something else. So the next slide, I'm talking about the remaining, an estimate on the remaining uninsured in Prince George's County. So what I really want you to know is that there has been a 34% decrease since the start of the ACA in the uninsured population. We're always going to have some uninsured. We live in America. There are some people who will not use the resources to buy the health insurance, okay? But what I will tell you is it has made an impact on us in Maryland. It's made an impact for our hospitals, providers, and you can't get continued and forward movement in these health outcomes without people having the tools to go to see their providers, okay? Now, I know you hear a lot about the opioid deaths and drug and alcohol, and I see a lot of things in the news, a lot of misleading reports, and I know that we tend to be a little wonky, and so when people get numbers and they think they can slice and dice them, and it means the same thing, but it doesn't. So what we count and track here are counts. So I want you to think this is not a rate, so it's a count. So all total in Prince George's County, you know, from 2011 up to, this goes to 2015, there are 69 deaths related to alcohol and drug use in Prince George's County. Now, I need to put it in perspective because if you listen to some people, no, there's a national increase. It's increasing across the nation. Opioid deaths, heroin deaths across the nation, cannot deny it. But when you look at Prince George's County, we're a county of 1 million people, okay? So this is less than 1% of the deaths in this county. So it's actually 0.007. It is an issue. One death is a big deal. And if it's my family member, it's a bigger deal. Okay? So one death is horrendous and unnecessary. But the truth of the matter is, and you can look at the yellow line, is the heroin-related deaths. It is going up, 32, but 25% of those deaths are not Prince George's County residents. So 25% of the deaths that are happening here aren't residents. So people who live this lifestyle, you're buying it wherever, they're coming to party wherever it's happening. We absolutely promote the Narcan. Our health department trains not just law enforcement and public safety for the use of Narcan, and we provide those kits. We train John Q. Public. So if you know you've got family members, I'm that kind of mom. If I've got a kid that's out there and they're using drugs, I'm going to be the first in line and make everybody that's near them come show me how to use this Narcan because, you know, as long as they're alive, I've got hope that you can kick this habit one day. But dead is dead. All right, so you can put some judgment on it, you can try to qualify it, but dead is dead. And as long as you're alive, there is hope that you can kick it. And there are people who kick it every day. So if you know anybody like that, you got your neighborhoods and all this kind of stuff. Because really today, we've got a mandate on a few things. If we don't take care of each other, folks, we can't look and say, oh, that's not mine. We joke in Health and Human Services, all the kids in Prince George's County school systems are my kids. Okay? So when teachers make crazy comments, I'm looking at them cross-eyed and I call them out. Why are you talking about my kids? What you're doing for my kids? They're our kids. You're our people. And so we need to take care of each other. So if you know and you suspect that somebody is using, please call up the health department. We'll get you trained and get you some Narcan so you can carry it, okay? We want to make it available over the counter at the pharmacies. Some of our counties in the state are doing that. You don't even need a prescription. You walk in and get it. But dead is dead, okay? Now, the last thing I wanted to say about this slide is, I did tell you 20% don't live in our county. Doesn't matter because it's somebody's kid. So the last thing I'm going to talk about is our community health needs assessment. So we did a historic thing last spring. So we've got these wonderful 5 hospitals in the county, and you've got the health department. And to be perfectly honest, the community health needs assessment is kind of a requirement for each hospital to do. It's an IRS kind of thing, and there's so much community benefit dollars that can be allocated to hospitals. Well, what happened last year was that all 5 hospitals participated with the health department in our community needs assessment, and it absolutely was a fabulous experience. And I have to tell you, we did that one community health needs assessment. The health department provided the support and services for that, but we collectively agreed with 40 community experts. And I tell you, we created a stakeholders group of about 40, 45 people, every sector, legislation, public safety, schools, everybody at that table. And we fought hard with Post-it notes on what the priorities should be. It was very, very difficult. We did community surveys. We did a variety of things for this process. And what we collectively decided to do was to focus on behavioral health, obesity and metabolic syndrome, thank you, cancer, and overall social determinants of health. And some of those are access to care. It could be transportation. It could be access to healthy foods, a variety of things. But these are the 4 things that all healthcare stakeholders agreed to focus on behalf of the residents of Prince George's County. I need you to know that we're doing it for you. I was asked to explain Narcan, and the difference between fentanyl. So Narcan is a drug that reverses overdose. So if I am overdosing from an opiate, and that could be oxycodone, it could be heroin, we train you how to use the nasal version where you just do a shot. And what it does, it counteracts that process of you overdosing. It takes your high away almost immediately. The concern is that you could really go into withdrawal, but that rarely happens. But what it does, it reverses that so that your body doesn't die if you do it in time. And that's what that is. So Narcan is a brand name. There are generic brands. But it is a medication that will stop that overdose process and reverse it very quickly. Now, so the difference between the fentanyl and you've heard in the news, you've got the heroin deaths, and then you'll hear about the heroin laced with fentanyl. And what I guess I want you to understand is, back in the day, in the 80s, when we had this epidemic, we really don't want to see those days again. And I'm old enough to have been back here. We don't want to see those again. But what they do is they cut heroin with you name it. Back in my day, it was rat poison, a variety of things. But they have access from the internet to fentanyl. It's a pharmaceutical drug. It is not designed to get over counter, mix it with anything else, and it is deadly. And so if you don't know what you're doing, you lace it with something, and these folks are going to get your money, it kills you. And so we have had, the health officers around the state have had training from the DEA and a variety of people that come to our roundtables to fully explain how serious this is and where it's happening and what it's looking like. So it's nothing to poo-poo. It is very serious and it is deadly. And we're really concerned about it across the state and across the nation. Thank you, Ms. Francis. For bringing that. I'll go with my acronyms, and she'll always say, okay, what is that? We get a little wonky. So I'll end to wrap up. just to let you know, I appreciate you. We are residents, but I appreciate you because you come out in full regalia, and I want you to ask good questions, but you're engaged, you're knowledgeable. We don't take that for granted, and you keep us honest. And it is a pleasure to serve you. Thank you.
Thank you, Pam. Isn't our health officer wonderful? Can we give her another hand? Now, you all going to have to bear with me. I haven't done a PowerPoint in 20 years, but I'm going to try to do this quickly because I know that you really want to hear about the Regional Medical Center. And so, my job, this is what we said we were going to do, is give you an update on the primary health care strategic plan. And let me see if I can get this thing up here. Here we go. So here we go. We're going to do this update. And the first thing I want to say is that this process began as a result, again, of the study that was done by the University of Maryland School of Public Health under the direction of Dr. Dushanka Kleinman, once again, who is here with us and who has remained a partner of ours from that time in 2012. Dr. Stephen Thomas also has remained a wonderful partner. And I know that Dr. Wright has been mentioned several times, but that's only because Dr. Wright is right there with us. He has been here. He lives here in Prince George's County, works in Washington, D.C., but he is pushing health in Prince George's County, just about as hard as anybody we know. So the people who were really engaged in this was the Office, of course, of the County Executive, our Board of Health, the Prince George's County, the Maryland National Capital Park and Planning Commission, the Planning Department, the Health Department, and our Advisory and Stakeholder Committees. We had 2 committees of county residents, some who were professionals and others who were residents who are any members of the Advisory and Stakeholders Committees here today? I know that we have, can you stand up right quick? The Advisory and Stakeholder Committees? There you go. Still with us. And thank you so much for the work that you did. The goals of the strategic plan were to expand access to high-quality, patient-centered primary care, improve the health status of all Prince Georgians, and we can see that that's really happening already, and advanced health care as one of the economic drivers within Prince George's County. The planning process started again in December 2013 with our first stakeholders meeting, and then we had a series of public engagements all over the county to talk about what we really needed to do to pull this plan together. With the advisory and stakeholders committees again, and we had the benefit of being able, through Park and Planning, to engage the services of John Snow Incorporated from Cambridge, Massachusetts. The plan was actually published in December of 2015, and the recommendations, I'm really just going to go through them really quickly because there are a number of recommendations that we have actually been making some progress on. And they are to increase patient-centered primary care practices in high-need areas, to build capacity of existing primary care practices to operate as patient-centered medical homes, to build collaboration among Prince George's County hospitals, to develop workforce to support patient-centered primary care, to implement a marketing and branding campaign, to establish a primary health care alliance, which is a nonprofit organization whose sole mission would be to pursue various grant opportunities in furtherance of care coordination and other healthcare drivers. And we also intend to develop and implement a monitoring and evaluation program. Now, we have made, as I said, a lot of progress, but we've done it without too much additional county funding, although the county has invested about $2.6 million already in establishing new primary care practices. So the first thing I want to bring to everybody's attention is that we have brand new federally qualified health centers in Prince George's County. Many of you already know about Greater Baden Medical Services, which has 3 locations and 3 WIC locations, women, infants, and children's locations here in the county. And Melanie Griffith is here representing Greater Baden. Are you still here, Melanie? Oh, guess not. But in the meantime, we have other organizations have come into Prince George's County. Community Clinic, Inc. at Franklin Park in Greenbelt. The Mary Center came from Washington, D.C. and is in Adelphi. La Clínica del Pueblo has recently opened a practice in Hyattsville. And Family and Medical Counseling Service is also a Washington, D.C. federally qualified health center that is part of the next initiative I'm going to talk about, which is our Health Enterprise Zone. Now, this Health Enterprise Zone was developed, it was actually a result of a grant, a competitive grant that the Health Department won. Is it 2 years ago, Pam? 3 years ago? We're in the 4th year. Okay. And the deal was to set up 5 medical practices. This is what we promised to do. Set up 5 medical practices in an underserved area. The health department selected Capitol Heights, zip code 20743, and established within the last 4 years 4 brand new practices there and expanded Greater Baden in its Capitol Heights location. So the addresses are there, and all of our presentations will be posted on our websites, so you can get that information. But I just want to bring to your attention that since the beginning, we have served 52,000 patient visits of people who live or work in Capitol Heights. So it's pretty amazing, badly needed. Dimensions has also opened 2 locations for ambulatory care outside of the hospital. One in Suitland on Silver Hill Road is beautiful. And I want to tell you something. All of these practices are beautiful doctor's offices. And they have everything that all the doctor's offices that you want to go to really have. So I encourage you to please, if you don't have a primary care doctor, please use these practices. They're wonderful. The doctors are wonderful, and they have a heart for service. So please do go to Suitland on Silver Hill Road, and the beautiful new practice that's been set up on the campus of Prince George's Hospital Center, at the Cheverly Family Health and Wellness Center on Mercy Lane. I don't know if people are aware of what a partner Kaiser Permanente is to the county. Kaiser Permanente, which has one of its largest facilities in Largo, serves and covers 130,000 lives in Prince George's County. They have 90 primary care physicians. Of course, you know it's a closed practice. It's a health management organization, but they do wonderful health care. And there are 3 facilities in the county, and Kaiser is actually planning to open another facility in the county, or to greatly expand the facility in Largo. We have 31 new urgent care facilities in the county. 8 of which offer primary care. Now, this all goes to that recommendation in the strategic plan to increase patient-centered primary care practices in the county. So the urgent care facilities are a substitute for going to the emergency room, because emergency room care is extremely expensive. Urgent care is not quite as expensive. We have, and there are a number of physicians, 63 new physicians in these urgent care practices doing primary care or internal medicine, and 85 other providers, such as nurse practitioners and physician's assistants. This is all happening within the last few years. Folks in the medical profession understand that there are 1 million people here in Prince George's County who need health care, and that we are open for health care business. MedStar, I don't know if you're aware of this, MedStar has opened a brand new practice in Brandywine, where they have primary care, cardiology, ear, nose, and throat specialists, orthopedics, psychiatry, and rheumatology. As I mentioned before, the county has already directly invested $2.5 million in practices serving high needs areas, and our Economic Development Incentive Fund has provided loans to certain medical practices, thereby helping them to open and to serve Prince George's County residents. The county also routinely expedites building permits for new medical practices by deeming them as priority projects for permitting purposes. Those of you who work with the county know that the permitting process is somewhat complicated, but our permitting folks really do push medical practices through. And Pam Creekmer already mentioned going to another one of the recommendations, the need to collaborate among Prince George's County hospitals. We realized when we were working on the strategic plan that it may have been the first time all the CEOs and the CFOs of the hospitals were ever in the same room together, and that they realized that they had everything in common together. So the health department took the leadership of bringing them all together to create this unified community health needs assessment. So all 5 hospitals worked together for this first-time collaboration, and this unified focus, if you see our health indicators changing, it's because of the unified focus that the healthcare professionals have. We all realize that chronic disease is something that has to be focused on, and people have to be made aware that by your lifestyle and by your own personal actions, you can change your diabetes, you can change your hypertension, you can change so many things that drag your life down. So we're all kind of working together to change those things. And more collaboration will occur, because that's how all this energy being around healthcare will make all the difference. Now, in terms of developing, this is another recommendation, was develop a workforce to support patient-centered primary care. Dimensions is doing tremendous work in this area already. Dimensions has a residency program for family medicine with 12 new residents that Dr. Cooper is probably going to talk about, and in internal medicine with 42 residents. And the idea for this is that these residents who train here in Prince George's County, we hope they're going to stay here and practice in the county, and that they will have a love for the county the way that we do. It also serves as a training hospital for students from Prince George's Community College, George Washington University, the University of Maryland in Baltimore, in a lot of disciplines, nursing, physician's assistants, pharmacists, respiratory therapists, nutritionists, physical therapists, occupational therapists, and midwives. Prince George's Community College also is working with Dimensions to try to fashion and very strategically train the health professionals for this new age of medicine. Now, we're talking about the health professionals for the new age of medicine under the Affordable Care Act, which is actually making, it has transformed the way medicine is being delivered. So that's even more reason why we have to work really hard to keep the Affordable Care Act in some fashion that we can recognize, because it's actually working. And why would you change something that's actually working for so many people? Prince George's Community College, you already know that we have the middle college at the community college. And that is this wonderful program that is done in collaboration with the Prince George's County Public Schools, whereby high school students actually matriculate here at the community college campus and study health sciences. And when they graduate, they have an associate's degree. There's a 100% graduation rate. These young people then go on, their parents only need to pay for 2 more years of college to get their undergraduate degree. And there's a waiting list that's long as we can talk about. So, I mean, that's one of the innovative things that the community college and the school system are working together. And I just have to give a plug to the school system. We just learned this week that our Prince George's County Public Schools graduation rate is now 81.44%. Now, and that our dropout rate is at an all-time low. And remember, we have 130,000 children in our Prince George's County Public Schools. So always don't believe what you read about our schools. Our schools are rocking. They are absolutely rocking. So the health department is also a training ground. Let me get back to workforce. The health department is a training ground for health professionals. They work with the family residency program at Dimensions, and also provide a wonderful training experience for nursing students from the Howard University School of Nursing, the Chamberlain School of Nursing, Stevenson University, and Howard University School of Dentistry. We are also working with Kaiser Permanente to become a part of our training opportunities too. So let me go back to another recommendation, which is to implement a marketing and branding campaign. And I'm happy to say that our partners at the University of Maryland Medical System have engaged a consultant for this purpose. So we will be seeing new branding and marketing for the Regional Medical Center. We have a recommendation to establish the Healthcare Alliance, which is that nonprofit organization, and the County General Fund. We decided to support new medical practices directly instead of putting the money into the alliance. But we, as soon as we can get some funding, we will stand up the alliance. We have created the organization, but we have to make it work, and that's coming in the next year or two. And we will also, once the alliance is developed, we will implement the monitoring and evaluation plan. So that, I want to thank you for your attention. That is our update for the strategic plan, and I would like to now bring Daryl Mealy, Mr. Moskowitz, and Dr. Carnell Cooper forward for their presentations on the Regional Medical Center.
You now have postcards or cards that with an ink pen, and we want you to use them to write down your questions. We have our wonderful smiling volunteers who greeted you as you came in, who will be collecting those cards, and we will be answering questions. So make sure you use them because we're going to come by and pick them up. Thank you so much.
Good morning. We're going to try to speed through some of our slides since it's now pushing noon, so we can get to what Craig has to show you all. My name is Darrell Mealy. I am with the University of Maryland Medical System. And I'll walk through, what we're going to do is walk through a little bit of a presentation about what is UMS and how we operate a little bit. And then Craig is going to do a narration through what the planning is of the building, and also we'll also show another animation that we have done so that you kind of get a better visual for what we're thinking about. And then Dr. Cooper will close with expectations. So make sure I can move this. Well. There we go. Okay. I'm technically challenged, so bear with me. So the University of Maryland Medical System, and I'm not going to go through each bullet point here, but we are a state system that is focused on the state of Maryland. Please don't confuse us with the University of Maryland College Park. We are two separate entities. I wanted to make sure. A lot of people think we're all under the same umbrella, but we're not. UMS acts as its own separate entity, separate than the campus at College Park and at Baltimore. We do have significant ties with the School of Medicine, and they are partners on several of our campuses, but we have two separate entities. Just want to make sure people understood that. This chart kind of shows this. The white blocks on the left are our regional hospitals that we have throughout the state. The gold on the right are entities within the college that we interact with on a very regular basis. Once again, this just shows us the types of hospitals. I have a map in front of us that will show you where our hospitals are. So this map geographically shows the light blue is where we are located throughout the state. We go as far up as Bel Air, Upper Chesapeake area, out to the eastern shore, out towards Easton, and down as far as Charles Regional. Our main hub of a hospital is at the medical center. It is located in downtown Baltimore on the Baltimore campus, right near the baseball field. The goal for this new initiative is to transform the healthcare in the county. And this is just a little bubble diagram that shows how we need to coordinate through the primary care with the regional medical center and with the public health, what Betty just said a few minutes ago. Timeline. So I represent UMS from a facilities and design and planning perspective. And our timeline that we're marching towards right now is we received a certificate of need that was mentioned earlier back in October. And so for those of you that don't understand the certificate of need process, it's a long process that every hospital has to go through to get an approval of a project. And there was some back and forth between Dimensions Medical System, us as a team, and MHCC and HSCRC as part of this approval process. So at the end of the day, when we finally got our approvals, we had to make some concessions in order to get the project moving and approved. But we were skillfully able to maintain all of the programs that we wanted and to navigate the process to get us a project that is going to be viable for us, for this county. And so if you take a quick look at the timeline, there's different things that have happened along the way. We had the latest event. We just recently, last week, closed on the land. So the land is now a part of the Dimensions medical system. So there's been a lot of activity behind the scenes that's been going on for a long time, and some of it's just now starting to come to fruition. The next event that's going on is in our process of merging with Dimensions. There's a team of people working on it from multiple angles so that we can merge Dimensions into the medical system. Our goal is, I have a closing of between June and July. Our fiscal year ends at the end of June, so that is kind of another bullet target point that we need to maintain. We are looking to do a groundbreaking ceremony. Betty mentioned earlier, it's probably late summer, early fall out on the site. And right now I am projecting a completion of the project winter of 2020. So that kind of gives you all a timeline of where we're at currently. As I mentioned, this is just a bubble plan that kind of shows you the order of magnitude that goes on. This is not just about building a hospital. There's a whole slew of activities that are going on right now, independent of us designing and building the hospital, on multiple fronts. And I won't get into each one of these, but there's a lot of activity, more than you can appreciate. In this new building, I've listed some programs here that we are actively working with Dr. Cooper on. I think he may speak to some of these in his presentation, but what we're trying to demonstrate here is that there are infusions of new physicians, new clinicians, trying to improve the current state at Cheverly, so that the goal is, when the hospital is complete over in Largo, we have a better running, smoother oiled machine with better quality, better turnarounds, and more efficient. That's the result. Just a couple other notes, and I'm going to give this to Craig, that you understand what else is going on behind the scenes. Not only in a design perspective, Craig is actually actively working. He's in what we call construction document mode, which means we have architects, engineers, land planners finishing our design documents so that we can go to build. In the same breath, we are actively working with equipment selections, major equipment like MRIs, CTs, labs, CSP, our sterile processing that goes within the building. The goal is to try to make sure that our design marries up with the equipment that we're trying to use in the building. We've finished up we've had user meetings that we term users, whether it's with clinicians on the floors or with the county and or with outside utility companies like Washington Gas, Pepco, Verizon, WSSC, EMS, all kinds of different entities that have had influence on our design. What we're really trying to do is finalize that so that we are off to go finish our documents. So we have rounded that corner, I think, for the most part. and we're headed down the last leg, round and third. And last, I guess, this slide here, and Craig will hit on this as well. This hospital is for Prince George's County. Keep that in mind, but it's also, from our perspective, this is a broader play than just Prince George's County. This needs to be, in our mind, a destination hospital. That's what this is about. So not only does Prince George's benefit from this, but we want the outlying Metro DC, Southern Maryland, Northern Virginia area. We want this to be a destination place. And we can, when Craig shows you what that could be on our design, with these improved programs plus many more, that's the goal. So I'll turn this over to Craig. If you don't mind, Craig, I think I'm done. Yeah.
Which one's the forward? This
I
one?
think that one's the forward one.
Okay, great.
You got it?
Yeah. Hi, everybody. Craig Moskowitz with Wilmot Sands Architecture and Planning. We're a local architecture and planning firm that specializes only in healthcare planning. We work all across the country, mostly in the Mid-Atlantic region, but we're very excited to have been part of this process and to continue the process and realize this facility. This is going to be a state-of-the-art facility. We have had some difficult negotiations, protracted negotiations with the state and the Health Commission over time, but we're at a good place, and we're moving now aggressively towards bringing the hospital and the medical center to realization. And the part of the team that's worked with us, the folks at Graham and Parker, they're actually a Prince George's County-based architectural team helping us with the exterior design, have done a wonderful job in realizing what we think is really a beautiful signature facility that really captures that state-of-the-art feel. So this is the front elevation of the building. We'll look at it in a little more detail later, but what we're going to do is talk about the site plan. I want to focus on not just what the initial phases of the project will be, but what it might be when it's the success we all dream about, because there's a lot of planning for the roadmap to the future. So it goes way beyond what this initial facility might be. It goes to what our dreams are for what this facility will be as a true regional medical center. So from a site planning perspective, for those of you who have been following the project, and I'm gonna kind of point, but I don't have a pointer here, so what I'm gonna do is just say the main entrance is on the left-hand side. It's on the lowest level of the hospital. The service side is on the right-hand side. Arena Drive is up to the top of the map, and Metro is down at the bottom of the map, just to get you oriented. And the Capitol Beltway is off to the left. So that kind of locks you. Metro stop right here. Down. It's directly adjacent to the Largo Metro station. Yeah. And you can see actually the tracks there. That's where it goes underground. You can see the tracks come curling around there on the bottom of the right. And Lotsford Road is over on the right-hand side on that edge of the property. There's the back half of the boulevard at Cap Center that you see noted here. The back half of that gets torn down, and then the side to the left there actually it will be redeveloped for much higher density mixed-use development. Will include some residential medical offices. I think it has a at least 6-story mandate for the new development that's in there, so it'll be a much higher density development that develops off to the side here. There's already new residential development that's been happening around the site. The part of the shopping center that includes Gold's Gym, that all gets torn down. Yeah, well, there will be a portion of the shopping center that remains. You see it here in the diagram off the left-hand side, but the goal is with the hospital medical center as the anchor that really helps this whole redevelopment take off, and that there'll be a redevelopment of a much higher density development that'll include retail, but include also office and residential, and it'll be actually a much denser utilization of this prime real estate right by the metro. One of the things that's important to understand is that as part of the roadmap to the future, there's also a lot of thought that has gone into what might happen in the future beyond the initial development. You see in green the parking garage, where that's kind of where the concentration of parking is. There are a number of surface parking lots. There's a tunnel that connects the parking garage right to the main lobby of the hospital. You see a couple of future medical office building spots over there on the campus. There's actually more development opportunities on the campus that I'll show you here in a second. But the goal is, throughout the whole planning process, is a roadmap to the future. We want to do what we negotiated with the state on, what has to be done right now for the current need, but we want to make sure that we've protected the ability for this facility to grow into the future and capture the future needs. What you see on this diagram are areas where there are expansion and growth opportunities on the campus. So that you see again the two purple squares up on the top for future medical office building opportunities. The hospital is in the white area, and the green areas around the hospital are vertical expansion components of the hospital. We've actually designed in the capability for a new patient tower that will house, it could almost double the capacity of beds in the hospital over time. That's what you see in the L shape there in the green. The other green area that you see connected to that L is the ambulatory care center, which will be built initially as a 3-story facility designed to be able to grow to 6 stories. And that'll have some of the ambulatory care components for the campus there. There's a lateral expansion. You see the orange areas. Those are lateral expansion zones for key departments like surgery, radiology, emergency, that are diagnostic and treatment areas that when the hospital grows, when the medical center grows, they have to be able to grow too because their volumes increase. And so that's all been anticipated in the initial planning for the campus. And then the area that you see, the purple area that you see down here on the lower left, that's also a development pad for the campus, for the center, for potentially things like medical offices, research, other related healthcare campus needs over time. As the demand is there, that's when they'll be realized. And the parking garage actually has the capability to expand to the east, and there's actually a parking garage, of course, developed in this purple area down here, if that were to be realized. So let's talk, I'm going to go relatively quickly through the floor plans because you can't really see all the detail in the floor plans. I'm just going to talk to you about generically what's on each level. This is a state-of-the-art facility. Even we went through all this negotiations back and forth with the state. There was a real interest at all levels, from the county, Dimensions, University of Maryland Medical System, to ensure that the programs that would ensure the operation of the facility as a state-of-the-art facility weren't compromised in those negotiations. And there are a lot of people that worked very hard to make sure that happened. And I think they deserve a lot of credit because that's really the end game for the facility. The way the building is organized, the areas you see in blue there are the patient floors, and those are located on top of a diagnostic and treatment platform, and at the lowest level, service and the main entry sort of public side that backs up into the service. It's designed with an on-stage, off-stage kind of circulation pattern. So when you come into the front door, you know, the public has one circulation path, and then service and everything comes from the back side, so you try to avoid crossing that, kind of like the Disney experience where you don't really see all the service things going on. So you try to do that through the building design. The area that you see dashed in on the left-hand side, that's that future patient tower capability that's been built in. And then you see the medical office building off to the left-hand side, that's dashed in also. And the reason it's dashed in is because from a certificate of need standpoint, the ambulatory care building is not part of the project because it's not a rate-regulated environment, it's a non-regulated environment. And so that was taken out of the project as part of the certificate of need process. It's still part of the project, but it has to be very carefully separated between regulated and non-regulated environments because that has to do with reimbursement and things like that. The lower level, as I mentioned, this is where you have, to the right side of the plan, you have all your service departments like sterile processing, pharmacy, lab, materials management. All those things are off to the left-hand side. The purple area is a dietary area, and you'll have a concourse that connects in front of the dietary area to the main entrance, and then that path on the outside of the building, there's a path that takes you directly down to the metro at the bottom of the page. There's a large conference center in pink at the bottom of the plan, and as you work up around that concourse, up and around to the left will be the ambulatory care center, which is the non-regulated environment. Directly straight up, you see the green arrow going straight up. That actually is the tunnel that'll take you over to the main parking garage. So when you come through that tunnel, you'll actually, and it won't be a tunnel like, I mean, it'll be a tunnel that looks like a nice finished space. We're not trying to create a creepy environment. This will be a nice, this will be a nice experience. But you'll come from there, and it'll be nice from an orientation standpoint because you'll arrive at the main lobby, and it'll be a two-story space, and there'll be the elevators and all that, and everybody from a wayfinding standpoint will know where they are. The emergency department is located on the floor above in the green area. It has, of course, its own separate walk-in entrance, as all emergency departments do, and an ambulance entrance, and that's organized there immediately adjacent to an observation unit that'll actually be managed by the emergency department folks. And then below that is the surgical services that has state-of-the-art operating rooms, some very large operating rooms for CVOR or open heart surgery, hybrid procedures. So they're really trying to make sure that these are sized correctly for the future and for all the equipment and complexity of healthcare that currently is required in a surgical platform. The blue area off to the left at the top is the imaging department. And that's mostly inpatient imaging. Outpatient imaging now, of course, directed by the reimbursement practices, is mostly done in an outpatient setting in a non-regulated environment. You wouldn't have that in a hospital anymore. When you come up, the next level is the women's and children's floor. And so the green area to the top is postpartum. To the right is labor and delivery, and the purple area to the bottom is the NICU. And they're all interconnected to be very efficient, to operate very efficiently, and of course work with an off-stage and on-stage kind of presence. The public circulation is the green arrows on the left-hand side. The service circulation, you see that red arrow going up and down. That's kind of gives that, again, backhouse connection between all those departments, separate from the public entry. And of course, there's security that is implemented in this very sensitive area for all these departments. As you go up into the building, the next level of the building has a behavioral health program, and the blue area to the back is actually part of the future patient tower, one leg of the future patient tower, but it houses a very important program, which is the residency program and some of the administrative spaces associated with that. And then we go up into the facility, we have patient floors. So this is the critical care floor, and then the intermediate care floor, which is designed to flex to critical care. So if the need is for more critical care in the future, we've designed that capability in. Then we have medical surgical floors, which are the general medical surgical needs. Same thing on the 8th floor, except that we also have the Mount Washington Pediatric Practice, which is a long-term pediatric care for mostly dealing with infants. And it resides currently in the hospital. That's in the wing in the yellow to the right.
Was on when he speaks, so when you look,
Microphone.
oh, it's working. I've got a big mouth, so I can start. Is it on? So one thing, when he plays this video, keep in mind one fact that's been kind of a running theme ever since we've gotten involved in this many years ago. There's roughly, Jeff may be able to give me the exact numbers, Jeff's over in the corner. I think there's roughly 25,000 residents from Prince George's County that seek health care, inpatient health care outside the county. Our design currently accounts for roughly 3,000 of those visits to come back to this hospital. So we are very optimistic that we could attract more. But when we do that, when you see the second flyby, that's what will be created because of that new demand. So that was just kind of important to see and remind folks of how we got to where we are versus what it could look like in the future. Thank you.
There's one more view here. This is the emergency department view at the walk-in entrance for the emergency department. And this is looking back from the main entrance towards the ambulatory care entrance. That's the front entrance of the ambulatory care building. And now we should start the animation. So everything you see here is part of the first phase. And the emergency department is just beyond that on that crossover road. There's the metro station. This one is now you see the future patient tower animated in there. Same time you saw parking garage. Lateral expansions and vertical expansions. Very proud to be part of. I want to introduce Dr. Carnell Cooper, and he wants to just kind of make sure he touches on some of the things that are going to be realized with the facility.
Good morning, everyone. I'll be very, very brief because I think what we really are interested in doing is answering all of your questions, and I'm sure there are lots of them. The hospital you have just saw is really going to be a full-service hospital, just with an expansion of what we have now. As you know, the current Prince George's Hospital Medical Center has complete medical and surgical service. It has a 24-hour ED. It has the second busiest trauma center in the state, seeing over 3,500 admissions a year, a full-service L&D, labor and delivery floor, as well as a neonatal intensive care unit, the only one in Prince George's County. We have a full cardiovascular surgery service that has really been rejuvenated in the past 2 years. We are now at a point where we're doing over 125 cardiac surgeries per year. Our cardiac surgery program has a three-star rating. That is the highest possible star rating in the country. So we are doing things that as we move towards the Regional Medical Center, we are doing things to get us ready for being a high-quality facility. We just in the past year became accredited as a chest center, as well as a chest pain center, as well as a stroke center. And all of these things, of course, are going to go into the new regional medical center. What is not at our hospital right now that will be at the new medical center is an accredited cancer center. We are currently going through the process to become accredited by the American College of Surgeons. That anticipated happening within the next year. So by the time we move into the Regional Medical Center, we will be an accredited cancer system that we're working with the University of Maryland, of course. The other thing that we don't have right now is an infusion center. An infusion center will allow patients to come in on an outpatient, get things like blood transfusions, get their chemotherapy, get other medications that can't be done as an outpatient that need an infusion center, and that we hope actually will be in place within the next year and a half. So those are the things that again that we have now, and those are things that are coming. What is new about healthcare in general and what will be part of our new medical center is really a turn towards population health. The medical center that we are building will be even more so in place to serve the members of the community, addressing things like smoking cessation, healthy eating, obesity, addressing some of the issues that Ms. Creekmore and Ms. Hager Francis talked about that are parts of the issues in our community. The ambulatory care centers that they alluded to are in place now. The connection between them and the medical center will be greater than it has been in the past. But at the end of the day, what's important is so much as not the building, but it's the quality of the care and your satisfaction with that care. That is the focus that we're working on now. We, as been alluded to earlier, we are not going to wait for the new hospital to open to address those issues. Those are things that we're addressing now. As most of you know, our NICU has been in the news in the past year. The NICU issues are issues that other NICUs across the country have had, including Hopkins and the University of Maryland. We are addressing it. We hope within the next few months to announce that our NICU will be reopening again. But there are other things that we are doing great that we continue to we will bring into the new medical center. Our mortality continues to improve. Our Maryland hospital acquired conditions are among the best in the state. So there are things that we're very proud of. There are things that we need to work on. And as we move to towards new medical center, those are things that are driving us, that we open our doors running. I want to just briefly, as I end on quality and satisfaction, I want to introduce some of the folks who are working hard to make sure that happens. A year and a half ago, almost 3 years ago, we opened a new family medicine residency program. We hadn't had one of the primary important things in providing primary care. The leader of that program is Dr. Stacy Ross, who is a resident of Prince George's County, who is here today, and I'd like for her to stand up. We invite you to send your patients to her at our Family Medicine Center in Cheverly as well as in Suiton. Dr. Sarah Dewson is also a resident of Prince George's County. I think she's our vascular surgeon. She unfortunately had to leave, but she is also, again, she did her training at the George Washington University Medical Center as a fellow in vascular surgery, and she, again, is someone who was born and raised in Prince George's County. So we're very proud to have her as part of our staff. And lastly, I want to introduce Mr. Hugh Guest, who's, again, a resident of Prince George's County, who's one of our board members, Mr. Guest. And then finally, in back there next to on his cell phone is the name Jeff Johnson, you've heard mentioned a long time, who's one of the people. Jeff, please stand up. Jeff is one of the architects that got us to where we are today, worked so hard to get the hospital started. I think those are all the folks who can remember. I don't think there are other folks from our hospital. If I missed you, please stand up. But again, thank you for coming, and we'll be happy to answer your questions.
And now is our time to answer a number of questions you may have had. I'm going to bring up Betty Hager-Francis with the questions that we have received from the audience. But aren't you excited about the future of good health care here in Prince George's County? You have to be.
So, hello, everybody. We have a lot of questions. So, I think that probably what we should do is try to answer as many as we can in a half an hour and call it at a half an hour, and then we'll post the answers to the questions online. And I'm just going to take some easy ones first so we can get those out of the way. And I'm going to ask Dr. Cooper and Darryl Mealy and Craig Moskowitz let's talk about the Anne Arundel Certificate of Need for Cardiac Care, because there are several questions about that, and we can just kind of get that out of the way as well. That will cover several questions. But the first thing is that somebody sent me a note to let me know that Kaiser does not have 3 facilities in the county. It has 4 facilities in the county. One is in Largo, one is Prince George's Medical Center on Bellcrest Road in Hyattsville, one in Marlow Heights, and another one in Camp Springs. So I apologize for that. They're 4 instead of 3. The 5 hospitals in Prince George's County are Prince George's Medical Center in Cheverly, Laurel Regional Hospital in Laurel, Doctors Community Hospital in Lanham, I guess it is, MedStar Southern Maryland in Clinton, and Fort Washington Medical Center in Fort Washington. So those are the 5 hospitals that we have right now. So rumor has it that the heart unit is to be deployed to Laurel. Can we speak on that? I do not believe that there is any plan to move the cardiac work to Laurel. That cardiac unit and that cardiac department is going to remain in the regional medical center. That's a very important element for why we're having the discussion about the certificate of need that's been filed for a cardiac surgery program at Anne Arundel Hospital Center. Please speak to the competing cardiac program proposed by Anne Arundel Medical Center. Dr. Cooper, do you want to talk about that at all?
So, as some of you may or may not know, the Anne Arundel Medical Center has applied for CON to start a cardiac surgery program at their hospital. That raises concern for us, of course, because it means that we will be competing for the same patients. The program itself has not yet been approved, and there are, I think, more questions to be answered just yet. From our perspective, we have witnessed a recent real rebirth of the program, and it is still growing. I think it has the potential to get to a point where it has as much as over 200 cases per year. So we are really concerned with a new program that will jeopardize the growth of our program. I think that is our main concern.
Thank you, Dr. Cooper. And you did mention that we've got, what is it, 4 stars out of 4 stars, that the quality is just outstanding.
Yes, 3 stars is the highest rating for a cardiac surgery program you can obtain, and we are in a 3-star program now since it actually began. That is due to the great work of Dr. Jamie Brown and his staff, who've done a tremendous job. We are really very proud of the work that we've done in rebuilding that program.
Thank you. There's a question, how many beds are in the hospital? There'll be 220 beds in the hospital. And there's a question about, can we count on getting money from MGM Casino? Now, I don't know if the money from MGM is going straight to the hospital. It's already been allocated, but we're anticipating about $40 million in tax revenue from MGM in this first year. And so we're happy to have them. Will there be any labor and delivery services at the new regional medical center? The answer is yes. And the issue of what businesses will remain at Largo Town Center other than the theaters, what businesses will be added, has the environmental impact study been done? And if not, will one be done and when? So Jeff, do you or Daryl, do you want to speak about that? We don't quite know how it's going to develop, but we are determined to have a really built-out Largo Town Center with mixed uses and very first-class mixed uses. Do you want to talk to that a little bit more?
Yes. As I mentioned in my piece of this, that we just recently had made a land transaction with the developer and the county. And so that's triggering, one, for any of the occupants that are on our side of the site are going to have to be vacated. RPAI is the developer. They're working with those entities to figure out whether they can move them on the site or what they're going to do. As far as the future goes, for the most part, the RPAI is intending to have it all to be a first floor retail type of development, with everything up above being either office or condominiums. That's the type of forethought they're looking at, and it's also governed by the mixed use that's been zoning that's been put into place. And so I would say probably not in the immediate future, but over a period of time, that every piece of the structure there, maybe except the movie theater, would probably be replaced or refurbished into something different, because it's all one level for the most part. So, thank you.
Thank you, Mr. Mealy. So will there be a dedicated pediatric emergency department? Hopefully there will be. Currently, pediatric patients have to go to Children's National Medical Center or Holy Cross in Montgomery County. Do we want to address that?
Sure, I can. Yes, there will be a part of our emergency room that will be dedicated to pediatrics. Those beds right now currently will be observational beds, so there will be patients who are going to be in the hospital less than 48 hours. So things like patients who may be having an asthma attack or perhaps an area of cellulitis on the hands that requires a short course of antibiotics. The patients who have much more severe illness will continue to be transferred to the local pediatric facilities. Children's, of course, has been a partner with us for many years now, and I think we will continue to have that partnership to make sure that we, again, treat the appropriate patients in the appropriate areas. But we will have an area for pediatrics, so we will keep as many as our patients who are pediatrics in our hospital as we can.
Thank you, Dr. Cooper. Dr. Cooper has led the many efforts in the Dimensions system over the last several years to move it forward again so that we're ready to become this new fabulous regional medical center. But the quality and all the different programs that you're running, we thank you very much, Dr. Cooper. So, are the slide presentations available? We will post them as quickly as we can get them up, including the video. Isn't that video wonderful? Did you love seeing that? I loved it too. When did Largo, Maryland become Southern Maryland? And so the answer is, let's start saying Central Maryland. Well, the deal is that the reason we are calling this a regional medical center is that the intention is for it to serve Prince George's County and Southern Maryland, because this is going to be a teaching hospital. It's not just a community hospital. There are many elements to this that are quite different from a community hospital. So that is why we are saying, and we really all have to kind of think about it, as that we are a sort of a central collecting point in this part of Maryland. That's what this hospital is really going to be. Do you want anybody want to give a better definition of a regional medical center? Okay. What are the road improvements that are planned? Are we working with Public Works in the state? I think Arena Drive has a pretty good capacity, and that was part of the reason that we selected Largo, was that the road capacity there is actually very good right now. Arena Drive, as you know, is open for 24-hour service, even though it was not right after the Redskins Stadium opened. But everybody uses it all the time now, and emergency vehicles will have access, very good access. And the road system around the hospital is actually designed, it was actually designed years ago over capacity, way over capacity. So I think that the road improvements will be minimal. Well, the football games, let's remember, we only have about, 8? Okay, 8 a year, 8 football games a year. And believe me, if our transportation departments and police departments orchestrated the MGM opening, we can handle the Redskins game with this. We definitely can do that. But all those things were thought about when we were planning the location at Fort Largo. And how many patient rooms? 220, and they will be private rooms. Yes, all private rooms. And we're even going to have a little section on many floors that have kind of an upgraded room. Is that correct? Okay. Sort of like Washington Hospital Center has the pavilion. Has anybody ever been there? Yeah, well, that's very nice. And we are going to have something like that. Only it's not going to be all one floor. It's going to be spread out over the. Am I doing okay? All right. Can you? Will the regional medical center? Oh, this is about the staffing of the regional medical center. Will there be persons of color, and will the majority of the person? We don't know if the majority of the personnel will be people of color. They will be highly qualified staff and a very diverse staff, and all the physicians will be certified, and we are kind of beyond that. I hope that we want to, it's just going to be an excellent hospital. What's holding up the groundbreaking? I think that Darryl Mealy explained some of the things that were holding up the groundbreaking, but the main thing was the delay in getting the certificate of need approved. And we haven't gotten yet to the permitting process. But we are working we will work very carefully with our partners at the Maryland National Capital Park and Planning Commission to get that process streamlined and done quickly. And then our partners at the permitting department are working with us. As you know, this will be one of the highest priority projects to get through. So the county is not going to be the problem. The county is never the problem in this project. I just want to let you know that. The mobile dental vans. Mobile dental, are there plans to increase their utilization with the public school system and the county in general? We try to work to keep the vans going. Some of our partners who signed up at first have been unable to sustain it. But Pam, what's the name of the little van that goes around all? Diamante Driver, but there's also another, Smile. And Smile is really consistent. So we can work with them to expand it. But we're always working to bring more health care to our public schools. And I just want to divert for a minute to let you know that within our transforming neighborhood areas, the 6 communities that the county executive has designated as needing some more concentrated effort, we have picked out 40 schools into which we have put some behavioral health clinicians and some social service workers who are actually there embedded in the schools to help the students and families. That doesn't have anything to do with dental, but I just wanted to let you know that anyway. But that is helping our students, and we know that that's going to help to bring that academic level of all of our students up. Because if the problems at home are solved, then the things standing in the way of young people learning will be greatly assisted. What are the plans to ensure that all projects related to the new regional medical system are inclusive and represent all groups, and especially those of Prince George's County? So I think that we talked about that before. And our goal is excellence, and we certainly are working with people in Prince George's County and businesses. The University of Maryland, Mr. Mealy and his team have been working with our Office of Central Services to assure diversity in the design and construction of this project. And I don't think we could expect any more cooperation than what we have been getting, and we do appreciate that. What existing businesses will remain at the Regional Medical Center? Well, the gym, we don't know the others. I think that question's basically been answered, but Gold's Gym is definitely going to move and be relocated, because that was one of the specific questions. What resources are being brought to bear to improve mental health and addiction services in the county? Our health department has really stepped up its focus on behavioral health and have combined substance abuse and mental health into one unit called behavioral health in the hospital. And we have some real experts now, more experts now, working with our population on behavioral health. We all know that the county has to step up its game on behavioral health. It's not just Prince George's County, it's the entire United States of America. But we know that we have to do even more. The Regional Medical Center is going to have a part of it will be devoted to psychiatry. But the main thing that we want to let people know is that we do have a network of clinicians, behavioral health clinicians, in Prince George's County. Our problem is getting people to admit they have the problem and going to get the help. So let's talk to our families about that. It's here. We have it here. We have plenty here. Our health impact study indicated that we basically have a good network of behavioral health providers. We just have to admit it and access it. But we also have to improve the way we give the information to our public. I'm sorry, I can't read that. This is a good suggestion. In addition to holding the live event, consider streaming the event and minimize introductions and closing remarks by officials. Okay, we got the message. We thought we had minimized it, but next time we'll do a better job. Okay, so there were several questions about what's going to happen to the existing Prince George's Hospital Center. And the answer to that is we don't know. It will likely be repurposed, but it will not be used for the same purpose that it's being used right now. The county will not let it just be an abandoned building on the top of that beautiful space. So the Park and Planning Commission has got a study underway as to how to repurpose that site. But the patients that would be going to that site will be going to the Regional Medical Center. At the ambulatory care center. So there is, you want to come up and talk about it? Sorry. Okay.
Hi. Pertaining to ambulatory services, at the current Chevrolet site, we have a new center, the Family Wellness Center at Chevrolet, and it's our goal to try to remain having primary care and some ambulatory services at that campus currently to serve the Chevrolet residents. We do not want to totally eliminate services there. We want to make sure that we're serving the Chevrolet area with the primary care services.
Thank you very much. Yes? I'm sorry, I didn't hear what you said. Is it possible to take a question from just right over here who didn't get Certainly. Certainly. Sure. Hello. I have a question relating to some of your services that you're talking about with the new regional medical center. And I think I'm just so happy. I'm so impressed with all these services here. However, my one question that I have is really important communication and accessibility. Will the hospital have, this new hospital here, will it have access to live interpreters? That is very important for the deaf community and deaf patients. Also, will it have VRI, called video related interpreting services? Sometimes you have to wait such a long time for those types of services. And also, will we have video phones so I can communicate with my family if something were to happen in the hospital? You know, with old antiquated technologies such as teletyping and what have you, I just want to make sure that we have accessibility for communication with patients. That's what I want to know, if that medical center will have that.
So I can.
Dr. Cooper will answer.
So the answer to that question is yes. We currently always get interpreting services for patients who need the kind of service you described as soon as the patient arrives on our premises. It's one of the first things that we do. In the meantime, we also have video services available in which we can connect a video link with signage and interpretive services as well, including not only signage but also different languages. We have both a person within the hospital who speaks something like Spanish, for example. We have an on-site interpreter, but we have immediate availability at any hour of the day or night for video links with other languages and signage on the campus at all times.
Thank you. Will you be procuring open MRI equipment?
To be determined.
Let me see. What plans changed due to state budget cuts? None. None. Right? Due to this year's state budget cuts?
No, what are they referring to?
I'm assuming it's the ones that were announced recently. Yes, yes, and nothing changed. Uh-huh. No, it was just, I can't, so I want to address this. In light of the fact that our school system does not enjoy a good reputation, that's a shame because they're doing great work, and I'm sorry to see that this was written, and our home values are not increasing. In fact, our home values are increasing in Prince George's County greater than other jurisdictions in this region in the last year. That is, I don't know, we don't always get the good media, but I just do want you to know that our home values have increased pretty dramatically in the last year. Barry, do you know the statistic? This is Barry Hudson, who's Director of Communication, and has all those facts in his head. Graduation rates. Mm-hmm.
Areas down like in South County with National Harbor, home values all over the county have gone up dramatically. So you should be proud of all the development and the density that's happening around the county allows for those home values to go up. So you're correct in the going up piece. I wish I had the exact number, but yes, it's absolutely going up.
More. 14%. 14%, which is a greater increase than any other jurisdiction in this region. And our director of our Economic Development Corporation compared our graduation rates to kind of big cities. And when you compare us to places like Boston, now I understand these are cities and not counties, but when you compare Prince George's County's graduation rates to places like Los Angeles, Boston, Philadelphia, Richmond, our graduation rate is the number one of all of those jurisdictions. Now, we in the state of Maryland, the state of Maryland is one of the best, has one of the highest ratings for educational achievement in the country. So some of our counties, our fellow counties, have higher graduation rates than ours. But when you compare us to other big cities, we're number one. But people don't know that. But I'm here to tell you. So that's true. We talked about the plans for the Cheverly site, and I think Vanessa is giving me the hook, because is it 1 o'clock? It's just about 1 o'clock. You have been so patient and so wonderful for this presentation, and we thank you. Vanessa, do you have some closing remarks? Okay. Thank you so very much, everybody.
I'm going to request that at your next update that you include the elected officials from Annapolis, Maryland, because none of this stuff can happen if we don't bring the money back. Just so you will understand, on Monday, we sent a strongly worded letter to the commissioner who will make the decision relative to Anne Arundel County Hospital getting their certificate of need as it pertains to the cardiac surgery unit that's here in Prince George's County. Anne Arundel County hospital system is 11 miles from where we're proposing to build this hospital. It is unacceptable that Anne Arundel County would have the audacity to slow down the progress that we're making for our hospital in Prince George's County. On Tuesday, we had a press conference. I want you all to know that the senators and the delegates are lockstep, 100%. We are not going to tolerate anyone stopping the progress of this new regional medical center. And I must tell you, it has not been easy. We have worked hard down in Annapolis, being sure that the money stays in place. The governor took we looked at the budget, $22 million of operational money has been taken out of the budget. But let me assure you all, we're going to put that money back. There's a lot going on, and I think we need to have these meetings more often. But I would ask kindly that you include an elected official from Annapolis, Maryland, because we want to talk about the money, because nothing can happen if you don't have the money.
Thank you so much, Senator Benson. Again, you have been a great audience. As we continue to give other updates regarding the new regional medical center, we will make sure all of you are well informed. We want you to stay hydrated, so please take a bottle of water as you walk out. And again, we will have all of the PowerPoint presentations up on the website within the next couple of days. As soon as we can get them, it will be on the county executive's website. Barry, if you could come up and give us your website address so people know where to pick up these, that would be great. Or you can go to the Prince George's County Planning Department website. We will have that. And before all of you leave, let me just give kudos to my staff, and Anika Jackson, Portland, and others from the Maryland National Capital Park and Planning, because without them, we could not put on a successful meeting. Anika and team, to the Department of Social Services volunteers, could you wave your hand? Department of Health volunteers, wave your hand. Family Services, wave your hand, because this has all been a team effort. We want to thank you so much. And again, Barry, if you could come up and give everybody the website address. Anika, if you could come up and give our website address.
Oh, you mean for this?
Yeah, no, she wants to know where they can get the PowerPoint presentation.
Okay. So once we set up everything on the website, you'll be able to go directly to the Prince George's County website. And let me just give you that address real quick. It's, of course, www.princegeorgescountymd.gov. And it will probably be on the county executive's page under Regional Medical Center. But what we'll likely do once we get it all set up is try to put it on the homepage part so that you'll be able to quickly get to it. But let me read that website address again, www.princegeorgescountymd.gov.
And for those who are interested in information about the primary healthcare strategic plan, you can find that on pgplanning.org. And you can go to our homepage, and it's right there on the front. Thank you.
And for those who are left, please give Anika a great hand. She is our coordinator, helping us put all the things together. So I would be remiss if I did not thank her, the team, and everyone else. So thank you a lot, Anika.